All right, everyone, let's dive right in. We're talking all about psychiatric nursing today, and I'm super excited to explore this, especially for all you future nurses out there. Because let's face it, this nursing process, well, it's your key to absolutely crushing it in mental health care.
That's right. It's way more than just what you read in the textbooks. We're going to really dig into why each step matters and how it all connects to, actually caring for patients in a real-world setting.
Okay, so our roadmap for this deep dive.
Yeah.
Psychiatric nursing process, a comprehensive outline. It lays out 6 core steps, and it's like a framework, a way to approach care strategically and holistically.
Think of it as your trusty compass, guiding you through the, well, sometimes crazy complicated world of mental health care. And it all starts with assessment, gathering all those crucial pieces of information about your patient.
And it's not just about the physical stuff, right? You're looking at the whole person, their entire world.
Absolutely. We're talking everything. Physical, of course, but also psychological, social, cultural, even spiritual and economic factors. Imagine the difference between a patient just saying, I feel anxious, versus actually seeing their behavior, their body language, maybe even talking to family about changes they've noticed. It's like, piecing together a really complex puzzle.
Oh, that's a perfect way to put it. It's like gathering data from all these different sources to create a full picture. Now, I know a lot of students get confused about the difference between, a nursing diagnosis and a medical diagnosis. Can you clear that up for us?
Totally. So a nursing diagnosis, it's all about how the patient is responding to a health problem, not the actual disease itself. So a doctor might diagnose, let's say, major depressive disorder, but your nursing diagnosis might be something like risk for self-harm related to depression. It's a subtle difference, but super important.
Right. So it's about understanding how that illness is actually affecting the person's life
Yeah.
and what challenges they're facing because of it. So we've assessed the situation. We've got our nursing diagnosis. Now what?
Time to set some goals. But not just any goals. We're talking SMART goals. That's specific, measurable, attainable, realistic, time-bound. Memorize that acronym. It's going to be your best friend, believe me.
It sounds simple, but I can already see how powerful that is in practice.
Yeah.
Could you give us an example of a SMART goal in the mental health setting?
Sure. So instead of just generally saying we want the patient to feel less anxious, a SMART goal might be the patient will be able to name 2 coping strategies for managing their anxiety, and they'll do this within 1 week. See the difference. You've got a clear target, you can measure progress, and it makes sure the care is really focused on what the patient needs.
I love that no more guessing games. Okay, we've got our roadmap, our compass, our SMART goals. Let's talk action. What does implementation actually look like in psychiatric nursing? What are you actually doing?
Well, this is where things get really exciting because the tools you have as a psychiatric nurse are so diverse. We're talking therapeutic communication, crisis intervention, meds management, milieu therapy, patient education. The list goes on.
Whoa, okay, that's a lot to unpack.
Hmm.
Can you give our listeners a taste of what some of those interventions might look like in action? Like, what are you really doing?
Sure. Let's take therapeutic communication, for example. It's way more than just casual chatting. You're using specific techniques like active listening, showing empathy, validating their feelings, and you're using all of this to build a real connection and help them process their emotions in a healthy way.
It's almost like being a therapist in a way, right?
You could say that. You're using those same communication skills to guide the patient towards, understanding themselves better and making positive changes. Then there's milieu therapy, which is all about, well, creating an environment that supports healing. Think of it as like intentionally shaping the space around them.
So it's not just the therapy sessions themselves, it's the whole atmosphere, the physical space, even the interactions on the unit.
Exactly. It could be something as basic as making sure there's natural light and comfy chairs, or it could be complex, like running group therapy sessions where patients can connect and learn from each other. It's about making a safe space for healing to happen.
Okay, I'm really seeing how all these pieces fit together. Now, we can't talk about psych nursing without talking about meds. What's the role of medication management in all of this?
It's huge, and it's so much more than just giving out pills. It's about understanding those meds inside and out, knowing their potential side effects, and really educating the patient so they can be informed and make decisions about their own care.
You're kind of like a detective too, right? Watching the patient closely, noticing any changes, and figuring out if the medication is really doing what it's supposed to.
You got it. It's a constant process of assessment, observation, communication with the patient and the doctor. And sometimes you're coordinating care with other professionals too, like therapists, social workers, case managers, that whole team.
Speaking of case management, what does that role look like for a psych nurse?
It's like being the patient's advocate, their guide, helping them through all the sometimes complicated parts in the mental health system. You might be helping them go from the hospital back to their community, making sure they have access to resources, or supporting them in taking their meds consistently. It's a really hands-on, holistic approach.
So it's incredibly rewarding, helping people regain their independence and well-being. Okay, so we've covered assessment, diagnosis, planning, implementation, but we're not done yet, are we? Got to make sure all this hard work is actually working.
You're right. Evaluation is the final step. We're asking, are these interventions effective? Is the patient getting closer to their goals? And remember those SMART goals we talked about? This is where we put those to the test, where we see if we're making real progress.
So it's constantly checking in, reassessing, adjusting as you go.
Absolutely. It's dynamic, always changing and adapting to what that individual patient needs.
So you're using those critical thinking skills every step of the way, analyzing the information you have and making decisions based on what you see.
That's what makes the nursing process so awesome. It keeps you engaged, keeps you learning, and helps you give the best possible care to your patients. Now, I know some of you might be thinking about all the paperwork, the documentation, and yeah, it's not always the most exciting part of the job, let's be real.
But it's so important, right? It's not just a chore. It's a legal and ethical must-do.
You said it. Good documentation is how you make sure everyone's on the same page. Imagine another nurse taking over your shift. They need to know what's going on with the patient, what you've done, any concerns that need attention. You're talking to the whole healthcare team through that documentation.
So it's like creating a crystal clear roadmap for everyone involved in that patient's care.
Exactly. And accurate, thorough documentation can even help make care better in the future because it provides valuable data for research and quality improvement.
Okay, let's make this more real for our listeners. We've talked about the steps, holistic assessment, SMART goals, documentation. But let's see how all of this actually comes together when you're caring for someone with a specific mental health condition.
All right, let's use the schizophrenia example from our outline.
Yeah.
It's perfect for seeing the nursing process in action.
Perfect. So imagine we have a patient who's been diagnosed with schizophrenia. Where do we start? How do we apply this nursing process?
Well, like always, it starts with that assessment. We need all the info we can get about this person's experience with schizophrenia.
What kind of information are we talking about? What are we looking for specifically?
We're looking for the classic signs and symptoms. Are they hearing things? Are they paranoid? Are they withdrawing from others? But it's not just about checking off boxes. It's about understanding how severe these things are, how often they happen, how much distress it causes them. Like, how often are they hearing voices? What are the voices saying? How disturbing is it for them? We also need to know how much insight they have into their illness. Do they realize the voices aren't real? Do they understand that their paranoid thoughts might not be based in reality? All of this helps us decide how best to help them.
So it's about understanding their personal experience, not just relying on, like, textbook descriptions of schizophrenia.
Right. And remember, we're not just listening to what they say, we're also watching their behavior, how they look, how they interact with others. Nonverbal cues can tell you a lot. Maybe they have flat affect, or they seem disheveled, or they have trouble making eye contact. All of these things give us more information about what's going on.
And we're talking to family or caregivers too, if we can, right? To get their perspective.
Totally. They can be such a valuable resource, telling us about their usual behavior, their support system, anything stressful that might be contributing to their current state. It's about gathering all the pieces of the puzzle from every source we can.
So we've got all this info from our assessment. Now it's time for the nursing diagnosis, right?
Right. And based on all the info we've gathered, a nursing diagnosis for this person might be, for example, disturbed sensory perception, and we'd say that's related to schizophrenia. This diagnosis focuses on their altered perception of reality, especially those auditory hallucinations.
Okay, so now that we have the nursing diagnosis, let's think about outcomes. What do we want to achieve with this patient?
Our main goal is always to help them manage their symptoms and have a better quality of life. So in this case, we might want to reduce how often and how intense those hallucinations are, and we might want to help them be more social, more engaged with others. We want them to feel more grounded in reality and more comfortable interacting with people.
And how do we take those goals and turn them into something we can actually do?
That's where our trusty SMART goals come in. For example, we could say the patient will report a decrease in how often they hear voices and how intense those voices are, and this decrease will happen within 2 weeks. Or the patient will attend one group therapy session every week for the next month. See, SMART goals give us something specific to aim for, and it makes it easier to know if we're making progress.
I love how clear and specific those goals are. Okay, so now, how do we plan and implement care for this person with schizophrenia? What are we actually doing?
It's a multifaceted approach, meaning we'll do a bunch of things. We'll probably start with medication because antipsychotics are a cornerstone of treatment for schizophrenia.
And patient education is a big part of this too, right? We need to make sure they understand their meds, the potential side effects, and why it's so important to take them as prescribed.
For sure. Building trust is super important here. We explain things clearly and simply with empathy and address any fears or worries they might have about the medication. We want them to feel empowered and informed, not scared or confused.
And part of that empowerment is helping them learn to recognize early warning signs of relapse and develop strategies for managing their symptoms, right? It's about giving them tools to take control of their own mental health.
Exactly. And along with meds, we'll probably use a variety of psychosocial interventions as well.
Can you give us some examples?
Sure, group therapy can be amazing for people with schizophrenia. It's a safe, supportive space to connect with others who get it, practice social skills, and learn coping mechanisms.
I can see how that would be so helpful, especially if there was drawing from others or feeling isolated.
Definitely. And we might use reality orientation techniques to help ground them in the present moment, especially if they're dealing with delusions or hallucinations.
So, like, if they're convinced the voices they're hearing are real, we might gently remind them that we don't hear those voices and that they're part of their illness.
That's it. We're not trying to invalidate their experience, but we're trying to help them separate what's happening in their mind from what's real in the world around them.
What about the therapeutic milieu? We talked about that earlier, but how would it apply to this patient with schizophrenia?
Ah, the milieu. It's all about creating a structured and supportive environment that helps people heal. So we might establish clear routines, offer meaningful activities, and create a sense of community on the unit. The environment itself becomes part of the therapy, not just the specific interventions we're using.
So it's about carefully shaping every aspect of the unit to support the patient's recovery.
Exactly. And safety is super important, especially for patients who might be at risk of harming themselves or others because of their symptoms.
So we're always looking for signs of agitation, watching their behavior, and stepping in quickly to de-escalate things before they turn into a crisis.
That's right. And if a crisis does happen, we need to be ready to respond effectively using our training in crisis intervention techniques.
Okay, so we've planned our interventions and we're implementing them, but we're not finished, right?
Mm-hmm.
We need to evaluate whether all of this is actually making a difference.
Absolutely. Evaluation is ongoing throughout the whole process. We're always checking on the patient's progress, seeing if their symptoms are improving, adjusting things as we go.
Right.
Are the hallucinations happening less often? Are they less intense? Is the patient participating more in group therapy? Are they using those coping mechanisms we talked about? And if things aren't improving, we go back to the drawing board and figure out what needs to change.
It's all about being flexible, responding to what you're seeing, and making sure your approach fits that specific person.
And speaking of high quality care, I want to bring up something super important, the QSEN competencies. Can you tell us a little bit about what those are? Sure. The Quality and Safety Education for Nurses, or QSEN competencies, are basically principles that guide us in providing safe and effective care. They're woven into everything we do, from that initial assessment all the way to evaluating how things are going.
So for those nursing students listening, what exactly are these competencies?
There are 6 core competencies: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Each one of those plays a big role in shaping how we approach patient care.
Okay, big concepts. Can you break those down for us a little bit?
Definitely. Patient-centered care means recognizing that the patient is at the heart of everything we do. We respect their values, their preferences, their needs, and we involve them in decisions about their care every step of the way.
So it's not just us telling them what to do, it's a partnership, working together.
Exactly. Then there's teamwork and collaboration, which is all about working effectively as a team, doctors, nurses, therapists, everyone, to get the best outcomes for the patient. We communicate clearly, respect each other's roles, and make decisions together so that everyone's on the same page.
It's like assembling a superhero team with different superpowers, all working together to help that patient. Okay, how about evidence-based practice? What's that about?
Evidence-based practice means we use the latest research findings to guide our decisions. We stay up to date on what the research is saying and use that knowledge to make sure we're providing the most effective care we can.
So we're not just going with tradition or gut feelings, we're using scientific evidence to make decisions. What about quality improvement?
Quality improvement is about always looking for ways to improve, to make things better and safer for our patients. We try to spot areas where we can improve, we make changes, and then we measure whether those changes are actually working. It's all about constantly growing and getting better.
So it's about being proactive and not being afraid to change things up if it means better care. And of course, safety is crucial, especially in mental health, where people might be at risk of hurting themselves or others.
Absolutely. Safety is always a top priority. We follow safety protocols, stay aware of potential risks, and intervene immediately if someone's safety is at risk. And last but not least, there's informatics, which is all about using technology and data to improve care. So we're talking about using electronic health records effectively, protecting patient privacy, and using data to figure out how to make things better.
Wow, that's a lot to remember. It sounds like these competencies are really about providing the best possible care no matter what.
You got it. It's about being competent, compassionate, and dedicated to our patients.
Well, this is definitely inspiring. It's amazing to see how the nursing process and these QSEN competencies can work together to transform patient care in mental health.
I agree. The impact we can have as nurses is incredible.
And for all you future nurses out there, remember this. The nursing process isn't just a bunch of steps to memorize. It's a framework that will guide you throughout your entire career.
It's about critical thinking, compassion, and always being willing to learn.
And as you continue on this path in psychiatric nursing, keep exploring, keep learning, and hold on to that passion for mental health care.
We'll be back after a quick word from our sponsors. Stay tuned.
We're back, and we've been talking about this psychiatric nursing process, and it's like having a roadmap, right? But sometimes a roadmap just isn't enough. Sometimes you need something visual, something that really helps you see the connections in the big picture, especially for those of us who are visual learners.
You're thinking about concept mapping, aren't you?
Exactly. I know it might sound a bit intimidating at first, but I think it can be a super helpful tool.
It definitely can be. It's like creating one of those detective evidence boards, but for patient care. You're visually linking all the pieces, the data you gathered in the assessment, the nursing diagnoses, the goals, and the interventions.
Okay, I'm starting to see how this works. So for our schizophrenia example, what kind of things would we be mapping out?
Well, you'd start with the patient's biggest concerns, the things they're struggling with most. In this case, it might be those auditory hallucinations, paranoia, and difficulty being social. Then you'd connect those symptoms to possible underlying causes, like the changes in brain chemistry that are associated with schizophrenia.
So we're literally drawing lines between the symptoms and the biological factors that might be contributing. What comes next?
Next, we branch out to the nursing diagnoses. Remember, those are focused on the patient's response to the illness. So we might have disturbed sensory perception linked to those hallucinations or impaired social interaction because they're withdrawing from others.
And from each diagnosis, we'd map out our specific goals and interventions, right?
Exactly. So for disturbed sensory perception, our goals might be things like reducing how often and how intense those hallucinations are, helping them develop coping strategies, and educating them about schizophrenia so they understand what's happening.
And interventions for that could be medication, those reality orientation techniques to help them separate hallucinations from reality, and maybe even relaxation strategies to lower anxiety, which can sometimes make hallucinations worse.
You've got it. And the best part about concept mapping, it's not set in stone, it's a living document. As you're doing those interventions, you can actually track the patient's progress visually. Are the hallucinations decreasing? Are they interacting with people more? It's a real-time picture of how they're doing.
That's really cool. I can see how this would help nursing students and even experienced nurses see the whole picture and really understand how everything connects.
Absolutely. It takes those abstract concepts from textbooks and makes them tangible, something you can see and use. It bridges the gap between the theory and practice.
Okay, so concept mapping is great, but we can't forget about the less glamorous side of nursing documentation. We know it's super important, but let's be real, sometimes it feels like a mountain of paperwork.
Tell me about it. But in psychiatric nursing, documentation is more than just checking boxes. It's about capturing the nuances of the patient's experience, how well those interventions are working, and why we're making certain decisions. It's a vital part of providing truly individualized and effective care.
So it's not just for the record, it's actually informing care as you go. What are we documenting specifically in psychiatric nursing?
Well, think about our patient with schizophrenia. We'd be documenting their mental status exams, any changes in their symptoms, how they're responding to meds, how engaged they are in therapy, and any concerns about their safety or if they might be a risk to themselves or others.
Especially if they've talked about harming themselves or others, right?
Exactly. That's crucial information, both for keeping the patient safe and for making sure everyone on the healthcare team is in the loop.
So what are some golden rules for documentation, especially in mental health settings?
Accuracy is number one. We stick to facts, what we actually observe, not opinions or judgments. We use clear, concise language that everyone can understand, no jargon. And of course, we're always protecting patient confidentiality, keeping that sensitive information private.
And we're documenting things as they happen, right? Not waiting till the end of our shift to write down something important that happened hours ago.
You got it.
Yeah.
We call that contemporaneous documentation, and it's key. It paints an accurate picture of what happened when and gives everyone a clear understanding of the patient's condition at any given time.
Okay, so we're accurate, timely, objective. What else should we keep in mind?
It's important to include the patient's perspective. We want to capture their experience of their illness, their concerns, their goals, their fears, their hopes. Direct quotes from the patient can be really powerful here.
So it's not just a medical chart. It's capturing that human element, their unique story.
Exactly. And remember, documentation is communication. We're writing for the whole team now and in the future.
So it needs to be clear, organized, and easy to read. No one wants to decipher messy handwriting or confusing sentences at the end of a long shift.
Exactly. And if we're using electronic health records, we need to know the system well, use the right templates, and make sure we're documenting in the correct sections. Organization is key.
So documentation is definitely a skill, but it's such a crucial part of providing quality care that's truly centered around the patient.
Absolutely. And here's something to think about. Our documentation isn't just about the present, it can actually help improve patient care in the future.
Really? How so?
Well, all that documentation provides data that can be used for research, quality improvement projects, even changes in policy. Every detail we write down, every observation can contribute to a better understanding of mental illness and lead to more effective treatments down the road.
Wow, that's amazing. So every note we write is like a little piece of a bigger puzzle that's helping us understand and improve mental health care as a whole.
Exactly. Your documentation isn't just a task, it's a legacy. It has the power to shape the future of mental health care.
I love that perspective. It's really empowering to think that something as simple as careful documentation can have such a big impact. Okay, so we've talked about documentation, but now I want to shift gears a bit and talk about something that often causes a lot of anxiety for nursing students' medication management.
That's a great topic. Psych meds are a big part of treating mental health conditions, and as nurses, we have a huge responsibility to make sure those medications are used safely and effectively.
Absolutely. But before we get into specifics, what are some key things about psychopharmacology, those basic principles that every nursing student needs to understand?
Well, one of the most basic concepts is that psych meds work by affecting neurotransmitters in the brain.
Neurotransmitters, those are the chemicals that allow brain cells to communicate with each other, right?
Yeah. Right. And different medications target different neurotransmitters, which is why they have different effects on mood, thoughts, and behavior. For example, antidepressants often target serotonin and norepinephrine, while antipsychotics typically act on dopamine.
So understanding that helps us understand how a medication might affect a patient and what side effects to look for.
Exactly. And it's important to remember that everyone reacts to medications differently. What works great for one person might do nothing for another, or even cause problems.
So it's not one size fits all. It's about finding the right medication and the right dose for each individual. And that's where nurses come in, right?
Absolutely. We're the ones watching the patient closely, monitoring for both good effects and side effects, and then communicating all that information to the doctor. It's a team effort, and what we observe is super important for making sure the treatment plan is working.
So we're like detectives, looking for clues about how the medication is affecting the patient, both physically and mentally. And we're also educating the patient, right? Making sure they understand their medication and are involved in their own care.
You got it. We explain what the medication is for, potential side effects to watch out for, how to take it correctly, and when to call their doctor if they have any concerns. We want them to feel empowered, not just like they're being told what to do.
And let's be honest, sometimes patients might be hesitant or even refuse to take psych meds. Maybe they're worried about side effects or the stigma of mental illness, or maybe they just don't like the idea of taking medication. How do we approach those conversations?
That's a really good point. We have to approach those conversations with empathy and validation, acknowledging their concerns and giving them accurate information. Sometimes it's about changing how we talk about medication.
So instead of saying, you need to take this to fix your brain, we might say, this medication can help balance the chemicals in your brain that are contributing to these symptoms.
Exactly. It's about shifting the focus from fixing to supporting and emphasizing that the patient is in control.
Okay, so we've talked about some general principles. Now let's get into specific types of medications we might see in psychiatric nursing. What are some of the big ones we should know about?
Well, let's start with antipsychotics, which are often used to treat things like schizophrenia, bipolar disorder, and even severe depression with psychosis.
So for our schizophrenia patient, antipsychotics would probably be a big part of their treatment plan.
Absolutely. They work by blocking dopamine receptors in the brain, which helps reduce those core symptoms of psychosis, like hallucinations, delusions, and disorganized thinking.
And there are two main types, right? Typical and atypical antipsychotics. What's the difference?
That's right. Typical antipsychotics, sometimes called first-generation antipsychotics, have been around longer. They're effective, but they also have a higher risk of certain side effects, especially extrapyramidal symptoms.
Extrapyramidal symptoms, those are the movement disorders, right?
Oh.
Like tremors, stiffness, restlessness. I've seen patients who develop those side effects, and it can be really hard for them.
It can be. And that's why atypical antipsychotics or second-generation antipsychotics were such a big step forward. They tend to have a lower risk of those movement problems, although they might have a higher risk of metabolic side effects, like weight gain, high cholesterol, and high blood sugar.
So it's about weighing the pros and cons, finding the right balance for each patient. And that means monitoring is super important, right? We need to be on the lookout for those side effects and adjust the treatment plan as needed.
Exactly. We're watching for those movement issues, keeping an eye on their weight and metabolic markers, and being especially careful about tardive dyskinesia, which is a serious movement disorder that can happen with long-term antipsychotic use.
Tardive dyskinesia, that's the one with those involuntary movements, often of the face and tongue, right? And it can be irreversible in some cases, which is scary.
It is a serious concern, and it really emphasizes why careful monitoring and patient education are so important. We want to catch those side effects early and make changes to minimize the risk. It's not just about giving them pills, it's about being actively involved in their care and safety.
Okay, so we've covered antipsychotics. What's next?
Let's talk about antidepressants. These are the go-to meds for depression, anxiety, even some chronic pain conditions.
And I'm guessing they work by boosting those feel-good neurotransmitters like serotonin and norepinephrine.
You got it. There are a few different classes of antidepressants, each with its own way of working and its own potential side effects. It might seem a bit overwhelming at first, but once you understand the basic differences, it makes medication management a lot easier.
So let's break it down. We have the SSRIs, the selective serotonin reuptake inhibitors. Those are often the first choice for treating depression, right?
Right. Medications like fluoxetine, Prozac, sertraline, Zoloft, and paroxetine, Paxil, are all SSRIs. They work by increasing serotonin levels in the brain, which helps improve mood and reduce anxiety.
And they're generally pretty well tolerated, but I know they can cause side effects like nausea, trouble sleeping, and sexual problems, which can be a deal breaker for some people.
That's true. It's so important to be open and honest with patients about those potential side effects so they can make informed decisions about their treatment. Now, there's another class that's similar to SSRIs, but also increases norepinephrine, the SNRIs.
It's NRIs, that's serotonin norepinephrine reuptake inhibitors, right? Those are often used when someone has both depression and fatigue or low energy.
Right, again. Medications like venlafaxine, Effexor, duloxetine, Cymbalta, and desvenlafaxine, Pristiq are SNRIs. They work on both serotonin and norepinephrine, which can help with those extra symptoms.
And then there are the tricyclic antidepressants, which I remember learning about in pharmacology class. They're not as new, but they're still used for some patients.
They are. Medications like amitriptyline, Elavil, and impropriant, Tofranil, are tricyclic antidepressants. They work on serotonin and norepinephrine, but they also have anticholinergic effects, which can lead to side effects like dry mouth, blurry vision, and constipation.
Yeah, those anticholinergic side effects can be really uncomfortable, especially for older people. What about MAOIs? I learned about those, but it seems like they're not prescribed as much anymore.
You're right. Monoamine oxidase inhibitors, or MAOIs, like phenelzine Nardil and tranylcypromine, Parnate, aren't as common anymore because they can interact with certain foods and medications. They require a special diet and careful monitoring, but they can be really effective for some people who haven't responded to other antidepressants.
Wow, there's so many different antidepressants out there, each with its own quirks and considerations. It's like a puzzle, trying to find the right fit for each patient.
It can be. And that's why it's so important for nursing students to have a good grasp of psychopharmacology. You need to know the different types, how they work, what they're good for, their risks, and the common side effects.
And we're constantly evaluating how the patient is responding, right? Not just their mood, but their behavior, sleep, energy levels, all those little clues.
Absolutely. We're also teaching the patient about taking their medication consistently, the potential for withdrawal symptoms if they stop suddenly, and the importance of telling their doctor about any side effects or concerns they have. The more the patient knows, the better equipped they are to participate in their own care, and the better the outcomes tend to be.
Okay, so we've talked about antipsychotics and antidepressants. What other types of psych meds should we know?
Well, mood stabilizers are super important for bipolar disorder. They help even out those mood swings, prevent both mania and depression, and lower the risk of suicide. Lithium is a classic mood stabilizer, but it requires careful monitoring of blood levels to make sure it's safe and effective.
And some anticonvulsant medications like valproic acid, Depakote,
Right.
and Lamictal can also act as mood stabilizers, right?
They can. They're often used as alternatives to lithium, especially for people who can't tolerate lithium or who have certain medical conditions.
And then there are anxiolytics, which are specifically for anxiety disorders.
You got it. Benzodiazepines like alprazolam, Xanax, lorazepam, Ativan, and clonazepam, Clonopin, are commonly prescribed for short-term relief of anxiety. They work fast, but they can also be habit-forming, so they're not usually used long-term.
They're best for those really intense acute anxiety episodes or specific situations like fear of flying,
Yeah.
right?
And for long-term anxiety management, medications like Buspar, might be a better option. It works differently than benzos and doesn't have that same risk of dependence.
Wow, it's a lot to learn about these medications. But thanks for breaking it down for us. Medication management is definitely a complex but crucial part of psychiatric nursing.
It is, and you don't have to become an expert overnight. Start with the basics, those core principles of psychopharmacology, and build from there as you gain experience. And don't be afraid to ask questions. The more curious you are, the better you'll be at navigating the world of psych meds.
Great advice. We'll be right back to dive into some of those essential skills you'll need as a psych nurse. All right, welcome back, everyone. So we've talked about the nursing process, concept mapping, documentation, and all those meds. But now let's get to what I think is the real heart of psychiatric nursing, those essential skills that go way beyond textbooks and really make a difference in your patients' lives.
You're talking about that human connection, right? The art of therapeutic communication and creating a safe, healing space for people who are going through mental health challenges.
Exactly. These are the skills that can turn a regular clinical interaction into something truly therapeutic. So let's start with therapeutic communication. It sounds pretty basic, but I'm guessing it's more than just having a friendly chat with patients.
Oh, yeah, it's definitely more than just chatting. Therapeutic communication is a very intentional and skillful way of interacting with patients, and the goal is to help them understand themselves better, make positive changes, and build a real, trusting relationship with you. It's about deep listening, understanding their point of view, and responding in a way that helps them grow and heal.
So what are some of those key techniques or strategies? I know active listening is a big one, something we hear about all the time, but what does it actually look like when you're with a patient?
Active listening means being totally present, completely focused on what the patient is saying. You're not just listening to their words, you're paying attention to everything, their body language, their tone of voice, their facial expressions. You're letting them know through your words and actions that you're right there with them in that moment.
It's like you're stepping into their shoes, trying to see the world through their eyes.
Yeah.
And part of it is reflecting back what you hear, right? Like saying, it sounds like you're feeling really overwhelmed right now, just to make sure you're understanding them correctly.
That's it. Reflecting back not only makes them feel heard and understood, but it also helps them clarify their own thoughts and feelings. Sometimes it's really helpful to hear someone else put words to what you're going through, especially when you're struggling to make sense of it yourself.
And then there's empathy, which is so essential. It's about putting yourself in their place, trying to understand their experience, even if you haven't been through the same thing.
Exactly. It's not about agreeing with them or saying what they're doing is right, but it's about acknowledging that their feelings are real and valid, even if you don't fully understand why they feel or act a certain way. And that validation piece is huge, isn't it?
It is. It's about letting them know that it's okay to feel what they're feeling, even if you don't agree with their choices. It's about creating a safe space for them to just be themselves without judgment.
Exactly. And remember, therapeutic communication isn't about giving advice or solving their problems. It's about empowering them to find their own solutions and supporting them as they figure things out.
So it's more about guiding than directing, helping them discover their own strengths and resources.
That's a great way to put it. And sometimes the best thing you can do is just be there, listen, and create that safe space for them to process their emotions without feeling pressure to come up with answers. Silence can be really powerful sometimes.
That's so true. We often feel like we need to fill every silence with words, but sometimes just being present is more helpful than anything we could say.
I agree. And speaking of questions, asking open-ended questions is another important technique. Instead of those yes or no questions, we try to ask open-ended questions that encourage the patient to share more, to explain their perspective, and really explore their thoughts and feelings.
So instead of asking, "Are you feeling anxious today?" you might say, "Tell me about how you're feeling today." It opens up the conversation and invites them to share more.
Exactly. Open-ended questions are like invitations to explore their inner world, and they often lead to much richer, more meaningful conversations. And we can't forget about nonverbal communication. It's a huge part of how our message is received.
Oh yeah, our body language says so much whether we realize it or not. Making eye contact, keeping an open posture, using appropriate facial expressions, all of that conveys empathy and genuineness in a way that words sometimes can't.
Right. It's about being congruent. Our words, our tone of voice, and our body language should all be sending the same message of empathy and support.
So it's not just what we say, it's how we say it. It's about our whole presence communicating care and concern.
You got it. And remember, this takes practice. It's about being self-aware, noticing our own nonverbal cues, and being mindful of how our words and actions affect the patient. The more we practice, the more natural it becomes.
Okay, let's shift gears a bit and talk about crisis intervention. I know this can be a really stressful situation, especially for nursing students who are just starting out.
Crisis intervention is all about responding effectively and with compassion when a patient's mental health is in a really bad place. It's about knowing how to assess what's going on, de-escalate the situation, and keep everyone safe, the patient and yourself.
So we're talking about situations where someone might be suicidal, really agitated, having a panic attack, maybe even becoming violent. Those are intense situations that require some special skills and a calm, clear head.
You're right. And in those moments, safety comes first. We have to make sure everyone is physically safe, including ourselves. That might mean removing anything that could be used as a weapon, calling for help, or even physically restraining the patient if it's absolutely necessary to prevent harm.
And I imagine communication is key in those situations too. We need to be able to de-escalate things with our words as well as our actions.
Absolutely. We talk calmly and clearly, use simple language, and avoid anything that could sound confrontational or judgmental. The goal is to bring the situation down, not make it worse. We want the patient to feel heard, understood, and supported, not threatened or judged.
So we might say something like, "I see that you're really upset right now. I'm here to help. Let's talk about what's happening and how we can make things feel safer."
Exactly. And it's so important to acknowledge their feelings, even if their behavior is challenging or they're seeing things in a distorted way. Sometimes just having someone who truly listens and acknowledges their pain can be incredibly calming and help them come back from that edge.
It reminds us that sometimes the best thing we can do is just be there with someone in their pain without trying to fix it or change it. And once the immediate crisis is over, then we can start helping them make a plan for handling future crises, right?
Right. We want to give them tools and strategies to cope with those intense moments more effectively next time. That might mean helping them figure out what triggers those crises, teaching them coping skills, and helping them build a support system they can rely on when they're struggling. It's about building resilience and giving them a sense of control, even when they're dealing with difficult emotions.
It's not just about putting out fires, it's about helping them build those fireproof walls so they're more prepared next time.
I like that analogy. And it's important to remember that crisis intervention can be tough on nurses too. We're human, and it's natural to be affected by these situations. It's so important to debrief afterwards, process our own feelings, and get support if we need it. We have to take care of ourselves so we can keep showing up for our patients.
That's such a good point. Self-care isn't selfish, it's essential if we want to provide compassionate care to others. Okay, before we wrap up this deep dive into psychiatric nursing, I want to touch on one more important aspect of care milieu therapy.
Ah, yes, milieu therapy, where the environment itself becomes part of the healing process. It's the idea that the surroundings can actually promote recovery.
So it's not just about those one-on-one interactions. It's about creating an overall atmosphere on the unit that supports well-being.
Hmm.
It's about making a space where people feel safe, supported, and empowered to heal.
Exactly. We're talking about building a sense of community, establishing structure and routine, and promoting independence and self-determination, all within a safe and contained environment.
So it's a holistic approach that considers everything: the physical space, social interactions, daily routines, and that sense of control the patient has over their own life.
That's it. And when all of those things come together, the milieu itself can become a powerful force for healing and growth. It's a beautiful reminder that recovery isn't just about individual effort, it's also about creating a nurturing environment where people can thrive.
Well, I have to say, I'm feeling really inspired by this whole world of psychiatric nursing. It's definitely challenging, but wow, the rewards are huge.
They are. And to all our listeners out there who are thinking about a career in psychiatric nursing, I say go for it. The world needs more caring, skilled, and dedicated nurses who are passionate about helping people with mental health conditions.
It's more than just a job. It's a calling. And it's one of the most meaningful and impactful paths you could choose. And remember, the learning never stops. Keep asking questions, keep that curiosity alive, and never be afraid to challenge those assumptions.
That's what keeps us growing, both personally and professionally. Be open to the unknown, learn from your mistakes, and never underestimate the power of human connection.
And that's a wrap on this deep dive into the incredible world of psychiatric nursing. We hope you found it informative, thought-provoking, and maybe even inspiring. Remember, you have the power to make a real difference in people's lives, so go out there, be the change you want to see in the world, and never stop learning.